You're listening to PetLifeRadio.com. Is your pet stressed out? Does your pet need annual vaccines? Which pet is best for a child? Would you know if your dog was in pain? Pet Life Radio presents The Pet Doctor, where you'll learn everything about keeping your pet healthy and happy. From pet care, pet meds and grooming, to pet food, pet insurance, and dental care, this is the place to find out everything there is to know about pet wellness. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets, because it's your pet. Health matters. Please welcome your Pet Doctor host, veterinary media consultant and veterinarian, Dr. Bernadine Cruz.
You know your pet better than anyone else. You would know if it were in pain. Or would you? Though pets are basically wired for experienced discomfort, as you and I are, too often they mask the typical outward indications like crying and whining for myriad reasons. So how can you tell if your pet is hurting? If you think they're ouchy, how about saving some money and dosing them with a bit of your pain medication? And what's so bad about pain anyway? Isn't it just a part of life? My guest is the Professional and Public Affairs Veterinary Advisor for the American Animal Hospital Association, Dr. Heather Loenser. In the next half hour, we're going to explore these questions and more, because every pet should experience the joy of a pain-free life. We'll be right back after this short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
This is Ed Lukasevic.
And Cindy Lukasevic at Dinovite.
This year, whenever you order a 90-day supply of Dinovite for your dog, we'll send you a free sample of one of the other doggy things we make.
Like Lico Chops, Super Mega Fish Oil, or Doggo Suds Shampoo.
What's on your dog's wish list?
We'll offer a different freebie each week at Dinovite.com.
Don't you just love the sound of healthy, happy dogs?
Dinovite is nutrition.
Dinovite for life.
DINOVITE.com.
Let's talk pets on PetLifeRadio.com. Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
Dr. Loenser, thank you so much for being with us today. This is such an important question that so many people aren't aware of and don't really think about.
Absolutely. So thank you for having me, and this is a subject that's near and dear to my heart. I've had many older animals. I've had animals myself that have gone through surgery, and then I've also spent 10 years in veterinary emergency rooms taking care of very sick and very painful animals. So this is something that I'm really excited to talk about today.
Awesome. Now, I mentioned that you are the Professional and Public Affairs Veterinary Advisor for the American Animal Hospital Association. I have a feeling many of our listeners have never heard of AAHA. What's AAHA?
Well, thanks for bringing that up. We love to get the word out because there's so many pet parents that get really excited when they find out what AAHA does. And the American Animal Hospital Association is the only organization that accredits small animal veterinary hospitals. And not all veterinary hospitals are actually accredited. Only about 12 to 15% of hospitals are. And what this means is that the hospitals have gone through an extra step of really making sure that they're practicing the highest quality medicine that they can. And they are held to over 900 standards of veterinary excellence. And this also means that they get evaluated every 3 years by our AAHA evaluators to make sure they're still meeting those standards. So if you want to find a veterinary hospital in your area that is accredited, you can go to AAHA.org or AAHA.org and click on our hospital locator and just type in your zip code, and a bunch of hospitals will pop right up for you to choose from.
So even if a hospital is not AAHA accredited, it doesn't mean that they're not good practices.
Exactly. So these hospitals that have decided to go through the process are just wanting to make an outward proclamation of what they've gone through. But I've been in many and worked in many non-accredited hospitals that do a fantastic job as well.
I know one of the things that AAHA does that is quite unique and is fabulous for all practices, all veterinarians, is that they write guidelines, and guidelines for a myriad of different subjects. How did they get into doing this? And I know one of the guidelines we're going to talk about today is this new one you've come out with for controlling pet and realizing that pets are in pain and what can be done.
Absolutely. Well, we're a nonprofit organization, and we're really motivated to empower and our veterinarians really all over the world. So we create these guidelines that are updated every several years by a panel of experts in the different fields, and we distribute these for free to really the entire veterinary community. We have guidelines ranging from anesthesia, fluid therapy. We recently finished one on hospice and palliative care, which is a brand new guideline for us. And the one we'll talk about today, again, will be pain management. And we're very careful to make sure that our guidelines are grounded in science and make sure that we have the most qualified and amazing people to help write them. So it's a true honor to work on these guidelines. That is part of my role. And my goodness, do I ever learn a lot just being a fly on the wall helping these be written.
It is probably one of the most frustrating parts. I know you working in emergency clinics, myself in daily practice, people coming in with pets and you're watching them limp, or they're having some difficulties getting up and down, or they have a lesion on their skin, they have itchy skin. I said, well, your pet's in pain. It's not in pain. I have a cat. My cat is purring. How can my cat be in pain? What are some of the most common misconceptions that you've run into about pets being in pain?
I think people really visualize their pet yelling and complaining the way we do when we stub our toe or have a stiff knee or have a bad back. I mean, human beings are pretty vocal about this.
I think we're wimps.
I think we might be. I know. And not that there's a gender predilection to that wimpiness or anything. Not at all. Not at all. But our pets don't do that. They don't want to announce to the world that they're uncomfortable. So it is really the rare pet that will vocalize, make a sound to declare that they're painful, especially in chronic pain. So there's very subtle signs that pet owners will pick up on, especially when we point them out to the pet owners. Like, is your dog or cat withdrawing from you? Like you're not seeing them as much. Is your cat hiding under the bed, or your dog isn't sort of underfoot all the time? Are they licking or biting themselves more? And that can be, not just for itchiness or to clean their fur or their skin, but that actually can be a way to try to alleviate pain. And do you find that they don't, curl up in a little ball and sleep comfortably anymore? Are they getting up and down in the middle of the night? Are they not actually able to get either into their bed or your bed or the couch? And they really can also avoid you touching certain areas or them using certain areas, like holding up a paw or not letting you or being excited about you petting certain areas like their back or their head or under their mouth in case their teeth hurt or something like that.
I think cats are really probably even better than dogs. I mean, dogs, you walk into the house like, I love you, I love you, I love you.
Exactly.
And, cats are a little bit more standoffish. They don't go for the walk with us. And I think sometimes you watch that little cat, because I am the quintessential kitty lover. I've had dogs, love dogs too. Mm-hmm. Hopefully someday in the future we'll have another one. But sometimes you just watch them and they're just sitting there with their little paws underneath them. So they're kind of up and they're looking at you, or their eyes might be a bit dilated, or you get near them, their ears seem to be a little bit flattened to their head. They just don't have that relaxed appearance anymore. I think
exactly.
That has a lot to do with it. They get that bedhead look. They're just not grooming themselves. It's just not an older cat, or they get really super fussy. Yes, those can be some of the other signs.
And you touched on something huge, that grooming is actually a huge sign of well-being in cats. And you think about all the gymnastics they do when they're grooming themselves, right? There's feet up in the air and they're twisted all around to get to that certain spot to get it all clean. And lack of grooming really is a sign of being uncomfortable. And imagine if you had back pain and you had to turn around and lick, one of your legs, you can't do that unless you're really quite comfortable. And another sign can also be urinary or fecal accidents not being able to get into the litter box, because it could actually be too tall for them to get into, or even getting in the posture to urinate and defecate could actually be uncomfortable for them as well.
That was one of the first signs, you're right, Heather, that I was noticing with my own old kitty. And I'm going, this cat was urinating outside of the box. She'd be in the box, but the urine would go over, and it was fairly high sides. It was going over the top of the box. And I'm watching this kid, and most kitties will kind of get in the box and they'll scrunch down and they pee. And this baby would start somewhat in the crouch, and then she would stand up and she would almost be on her tippy toes getting that last of the pee out as it's going over the side of the box. Like, really? So took her in, took some radiographs, and lo and behold, this baby had some arthritis in her back. Treated that, and she still, I think, liked peeing over the side of the box, but it got better.
Right. No, I think that litter box issues are, regardless of how old your cat is, that's a big soapbox of mine, is make sure that if your cat is having difficulty using the litter box, that's definitely something that warrants a veterinary visit. And maybe we'll find pain, or maybe we'll find another issue. But that's definitely one of the ways our kitties communicate with us.
It's not subtle, but it is so effective when we listen.
Is. Yes.
Dr. Loenser, if you would do me the favor of starting maybe from the tip of the ears to the tip of the tail of one or many of the kind of overlooked sources of pain. So what could be going on with the skin?
Oh, absolutely. So chronic allergies, red inflamed skin, there's actually a very fine line between being itchy and being painful. It's the same nerves that transmit that information, and it doesn't take long for lots of scratching to turn into a real source of pain. Also, if animals have ear infections, veterinarians think of the ears as skin, but sometimes pet owners don't, and ear infections are incredibly uncomfortable. I mean, the last time I had just swimmer's ear, from swimming and I was scuba diving, my goodness, the whole side of my face just radiated with pain, and I think we can underestimate how uncomfortable ear infections can be.
And we've had children with ear infections.
My
my goodness, a baby with an ear infection, just, stand back. That's horrid.
Exactly. Then if we go to the eyes, there can be signs of pain like squinting. That can be caused from ulcers, so scratches to the cornea. There, high pressure inside the eye, or something called glaucoma, can cause it. And then also any inflammation inside the eye. Again, that is going to feel like a horrible headache. And really the only way that dog or cat's going to be able to tell you is probably just by squinting their eye, just even subtly squinting their eye. Now, a huge source of pain, maybe I'm going to say some of the top 3 sources of pain, will be in the mouth, and that will be in the form of dental problems. So most animals, most dogs and cats, by the time they're 3 years old, have signs of dental disease. And that's not just necessarily red gums or tartar or bad smelling breath, but that can go all the way to having infections inside the mouth and abscesses and loose teeth. And if you think about the last time you had a toothache, I mean, I'm sure your dentist has an emergency line like mine does. That's why dentists are on call, is so that we can get our pain addressed when we as humans have dental pain.
But Dr. Loenser, I know so many clients are going, I've had dogs and cats for years and I've never had their teeth cleaned. This is just a way that veterinarians are trying to make money. This is ridiculous. They'll just fall out.
Oh, gosh. And it's true. They will just fall out. But that's a painful situation that's been going on for a long time to get to the point where they fall out. And since that dog and cat likely won't announce it to you, you just have to know that that animal's been living in chronic pain for a while. And they can do things like shift the food. If the right side of their mouth is sore, they can shift food to the left side of their mouth. But now if both sides are sore, they really can have a hard time eating. And you can see it as a pet owner as, they're messy, they're dropping food on the floor. Maybe they've become picky and they don't want to crunch on anything hard anymore, and they're sort of leaning towards canned food. But those are actually really significant signs of suffering. And that's something to absolutely have your veterinarian check out. And the first sign
is a source of pain for the entire body. So a source of pain, infection, and it can irreversibly damage so many organs just from those bad teeth that you've never had addressed. And even feeding those special dental chews and the additives to the water, the gold standard is really brushing. And even I brush and floss and use a Sonicare twice a day. I still need to go in 4 times a year and have my teeth cleaned. So, yep, you're right. It happens to pets too.
Exactly. So as we move down the body, I think the back is a source of discomfort in a lot of dogs and cats, just like it is with people. They have discs in between their vertebrae, just like we do, and that if those bulge or push on the spinal cord at all, that can cause pain and numbness. And then just any of the bones and joints, they can have arthritis. And we tend to I don't think we think about that, especially in cats. I think we underserve cats when it comes to arthritis. But our dogs and cats won't necessarily limp. They can just avoid doing things that make them use those joints, like climbing stairs, or jumping up on the counter, or jumping into the back of the truck, or up on the bed. So if you're finding yourself needing to lift up your animal more than you used to, it's not because they're spoiled, more than likely. I mean, I'm sure you're a well-trained pet owner and you know how to take care of, be bossed around. So. But it certainly means we could have an uncomfortable animal, for sure.
And then heart problems can cause issues too, correct? How would that show as pain?
They can. That would be a vague sign, I would say. So we have an animal that is in heart failure or has fluid in and around their lungs. That's going to be really uncomfortable in their chest. So they're probably not going to want you to pet them there very often. They're also, though, since that's a big deal, I mean, heart failure is a problem that affects the whole body. You will definitely see them, their activity level going down and not wanting to interact with you very much, and maybe having difficulty breathing too. And then
GI tract?
Yeah, GI. So think about how uncomfortable gas pain is for us. And that is the same thing with dogs and cats. If you have a bubble of gas in your stomach or intestines, if they become constipated and can't push feces out, that's a very uncomfortable situation. And to the point where we will often anesthetize our dogs and cats to remove feces that's gotten stuck inside for a long period of time. And then for our dog owners, if we have dogs that, especially large breed dogs, that have a twisted stomach, one of the first, which is called gastric dilatation and volvulus, or bloat, one of the first signs of that is that the dog gets very uncomfortable, pacing around, can't sit still, and it's because gas is accumulated inside the stomach and is getting bigger and bigger and bigger like a balloon, and that's really the worst gas pain ever. And then finally, the bladder can be a big source of pain.
Especially for cats, it seems like.
Oh my gosh, absolutely for kitties. So just inflammation inside the bladder, like from infection. Think of the last time if you ever had a bladder infection yourself, your stomach hurts. It hurts to pee, very uncomfortable. And then having bladder stones or bladder tumors can also be very uncomfortable as well.
These are all wonderful things. If people forget, I believe that you can go online to AHA, and they actually have guidelines and a lot of handouts and brochures, things that if you go, is this really a sign? They have some great handouts, correct?
We do. I'm very proud of them. So if people go to aaha.org, so aha.org, and just type into the search engine, there's a little like magnifying glass type thing. Just type in pain management guidelines and poof, there are pages and pages of not only the scientific articles that are very, very well written, pretty scientific, so you have to have that kind of bent if you enjoy reading that. But there's a bunch of articles for pet owners that we want our veterinarians to share with them. And so if you're a motivated pet parent, they're great resources for you to read and get up to speed on as well.
Well, I'm chatting right now with Dr. Heather Loenser. She is the Professional and Public Affairs Veterinary Advisor for the American Animal Hospital Association. We're going to be right back and talk about ways that we can treat these signs now that we know that our pets are in pain. And we'll be right back after the short break.
Please have a seat in the waiting room. The doctor will be with you shortly, right after these messages.
It's designerpetsweaters.com. Hand-knitted designer sweaters for your precious pup or cool cat. Beautiful couture patterns for your pets, including custom-knitted formal wear, casual wear, yachting, and even sports-themed. Many designer pet sweaters include feathered tammy hats, top hats, and a lot of sparkle. Each sweater includes leg loops, front paw sleeves, and leash opening. Visit designerpetsweaters.com to order your four-legged fashions today. Your pets will stay warm for the winter and be runway ready. Large or small, we fit them all. designerpetsweaters.com.
Hi, I'm Dana Humphrey, the founder of Whitegate PR. We have been specializing in PR and marketing in the pet industry for over 10 years. If you have a pet product or service you would like to promote, give us a call. We can help create awareness for your brand on TV, radio, magazines, newspapers, and blogs. Feel free to reach me directly at 619-414-9307 or learn more on our website at whitegatepr.com or follow us on Facebook.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
Welcome back to the Pet Doctor on Pet Life Radio. The doctor is in, and we'll see you now.
Dr. Loenser, you just gave us some great ways of knowing what to look for, where to look for these possible signs of pain. And one of the, I think, most frustrating things for pet owners is they bring that pet in and they say, my pet's been limping when it's at home, or my pet seems off. And there in the exam room, that kitty is purring, moving around, everything seems fine. The dog, you walk it up and down the hallway and you do whatever, and it's not showing any signs of lameness. And they feel like fools because we're not seeing anything. And I say, it's kind of like when you take your car to the mechanic or your child to the pediatrician. It never makes the sound. The kid feels great. But really, what you're seeing, I do believe you. So it's really a team effort for veterinary medicine in general to make sure your pet's is as good a condition. If there's anything you see, write it down. Let us know about it. Because if you don't, sometimes we just can't tell in that exam room.
And I think smartphones have really helped us a ton because I love it when people bring in videos of what their animal's doing. So you're exactly right, Bernadine. Don't assume that your animal's going to do what they're doing at home. So just start recording and bring that in so we can look at it.
And pictures of poop. I get lots of pictures of poop. Yes.
Yes, we have such a glamorous job.
It is. I know. All right. So we realize our pet's in pain. What can we do about it?
Well, it depends on the source of the pain, first of all. And some of the ones that are really the most prevalent will be arthritis pain and dental pain, which is another type of bone pain. So there are a ton of different drugs out there that work really, really nicely together. But a lot of times the first drug that most veterinarians reach for, especially for bone pain, are the non-steroidal anti-inflammatory drugs, or NSAIDs.
Like us taking ibuprofen or acetaminophen.
Exactly. So they don't sedate, so you can walk around and drive your car if you were a dog, but they do a nice job of taking care of pain. Some of our animals actually need to be on pain medication, especially arthritis animals, for quite a while. And a lot of my patients, including my own animals, have been on these NSAIDs for months to years because the safety profile of them really is great. And of course, you want to have your dog screened very carefully before you go on that journey, but their quality of life can really improve so significantly if their chronic pain is treated really daily. So the NSAIDs can be the hallmark of treatment for dogs. Now, cats are tricky, right? Because cats metabolize...
They're not little dogs, that's for sure.
I wish they were. This would make it so much easier. But cats actually, they metabolize drugs very differently, including these NSAIDs. So we have to be really careful to monitor our cats and screen our cats carefully before we put them on an NSAID trial. Because the kitties can have issues with their kidneys. So kitties having issues with kidneys. But there's some data out there now showing that low-dose, long-term use of certain drugs have not shown to shorten the life of cats. So that's something to really talk carefully with your veterinarian about. And there's studies in different parts of the world really showing that cats do well with this treatment. So if you have a kitty who seems to be uncomfortable or painful, do talk to your veterinarian about whether or not they would be a candidate for something like an NSAID.
Thankfully, our FDA does such a wonderful job of protecting people and pets. Sometimes I almost think you're right that they're protecting us maybe a wee bit much. Yes, our colleagues in Europe, Canada, many times are using medications that we, by FDA allowance, are not allowed to do. But I have to admit, Heather, that I've had some of my own older cats or cats had been in pain for one reason or the other, and it's like, all right, I will carefully use and monitor with blood work some of these non-steroidal anti-inflammatories, and it makes such a difference. And I will use it in my own clients and tell them this is what's called off-label. If there's any problems, contact me right away, let me know, stop the medication. But yes, it's important. What are some other medications that we can use other than these non-steroidals to keep these kids comfortable?
Well, there's something called polysulfonated glycoaminoglycans. So that's
easy
pretty
for you
fancy.
to say.
Yes, exactly. But everybody knows these. This is chondroitin or glucosamine. And I don't think there'll be a listener out there that hasn't heard of these drugs, either using them on themselves or on their animals. And the thought for a lot of these, especially joint issues, but also other areas like in the bladder where there could be inflammation, they do have some anti-inflammatory effects. The thought is that they do. Now, data is still pending on some of these drugs, but they're awfully safe. And if you talk to your veterinarian and they think the benefits of using them work for you, then it's a great thing to try. And these medications can come as in like sprinkles that you add on top of the food. There's actually even some prescription diets that have high levels of glucosamine in them. And also there is injections as well that you can give. Oh, another diet, a diet that can be used are ones that are high in omega-3 fatty acids. So things like fish oil, flaxseed oil, and those can be helpful as well. Now, neither the glucosamine or the omega-3s are substitutes for pain management in a serious situation, but if you already have an animal on some pain medication and you just want to kind of boost it up a little bit, that would be something to talk to your veterinarian about.
You're right, because it really needs to be a multimodal way of trying to treat these kids. It's going to be typically that long-term pain or maybe even short-term. But if we can get away with not having to use medications all the time, because I know so many people are afraid that their pet's going to get hooked on using a pain medication. They've heard about all the problems with people. And I said, well, I have never seen a pet yet their dog can get into that bottle of non-steroidals and chew open the bottle, but typically they're not going to be dosing themselves inappropriately.
Right. And I am grateful for that because it really means that we can push pain management maybe even further than we do in people because we're not worried about dependence and, a change in lifestyle and a life falling apart from a dependency. So we have things like tramadol, which is sort of a relative of morphine. It's in the opioid family, and that can help. It can cause some sedation, but may help in mild pain. A drug called gabapentin, which people use for back pain themselves. It helps with nerve pain. Amantadine, which is another sort of nerve blocking drug. Amitriptyline, which is people might think of as a antidepressant, which it is, and there's been some reports that it can help with chronic pain. Acetaminophen or Tylenol. Now, this is for dogs only.
Really need to be careful, yes.
It's a huge deal. So Tylenol is such a safe thing in people, right? We give it to neonates, really, tiny little babies, but it doesn't take much to kill a cat with Tylenol. And that goes back to the fact that they just don't metabolize some of these drugs the same way that dogs or people do. And some of the newer drugs, we have an antiemetic drug, which is one that stops vomiting. And there's some thought that might help in pain management. People are starting to use it around the time of surgery because some of the drugs we use to make an animal go to sleep can actually cause nausea or vomiting. So some veterinarians are starting to use this medication before they give the pain medication to stop vomiting, but it also may have some pain management effects.
I actually used it in one of my own old kitties who was in hospice care.
Okay.
And I was trying a little bit of everything. It's like, okay, I'm at my wit's end. I know that the time is soon, but I just want a little bit more time, please. So I did call a veterinary pain specialist, and they recommended Ropitin. And it's like, it really made a difference. So still had to go to heaven, but I got some good quality time for that baby.
Absolutely. That's so important. And in addition to drugs, especially for our animals that might be overweight, and really 1 in 2 animals are overweight, so over 50% of dogs and cats are overweight to obese. Weight loss is actually such a potent pain treatment because these animals are carrying around extra weight on their joints and on their back and on their muscles. And if they lose a couple of pounds, their activity level and their pain levels really can improve significantly. And
it's
then
amazing because it's not just even the fat. You think, okay, you're carrying around that weight. It's putting pressure on the joints. But you also, I found it was fascinating that the fat produces a tremendous number of chemicals, and many of those are pro-inflammatory. So you have that 1-2 wonderful positive punch for losing that weight. It's like, oh yeah, that's feeling much better.
Absolutely. And that's a new concept for me, that I just used to think of fat as just sort of sitting there. But knowing that it causes inflammation, we do want to get rid of it. We really do.
And I know after the recent elections we had, I live here in California, and now recreational marijuana is acceptable, but we've had medical marijuana for a long time. And many clients are really eager to use it for their pets. What's your feeling about the cannabinoids in pets?
I think we will probably eventually find a use for it in our profession. I think right now it's very hard to research it because the marijuana compounds are labeled in a way that they don't allow a lot of scientific research. They're scheduled as a class, I think 1 or 2, and it makes it very, 1. Okay, so it makes it very hard for researchers to get this and use it because it's in the same categories as things like LSD, where there's, no medical use for it, they think. And so it's really hard for us to know the dose, what dose is safe, what dose isn't safe, and what dose actually works, and for what indications. I mean, all the drugs we've talked about today so far, there's a huge dose range. And we use the low end of some drugs for things like low-level inflammation, and we use the high level for things like seizure prevention, almost, like with something like gabapentin. So there's really a lot to learn about it. And also, the FDA is not involved yet in regulating the cannabinoids, so we don't have a lot of understanding of how pure these medications are and what percentage of oil they have in them. There could be situations where people are making these drugs where there's varying degrees of potency. They say they have a certain amount in them, but there's no actual testing of that yet. So I think within our practice life, I think we very well could see more research, and there may be a time that we do prescribe it, knowing the dose and understanding the safety profile.
So many people, so many of my clients do not want to use drugs. Say, I don't use drugs on myself. I don't want to use it on my pet. What are some of the alternatives?
Well, there's a ton of them out there. We're so lucky. Acupuncture is huge. And I can't say that I understand acupuncture. It's not something I'm trained in. But do I ever believe in it? I've used it with my own animals, both dogs and cats. And I do recommend it for animals that are painful. But acupuncture is even being used way beyond pain as well. So it's certainly something to talk to your veterinarian about if your animal has any kind of health issue, but certainly something for pain. And I am amazed at how well they tolerate these needles. It's hard for them to see the needles, so it's not like they have some kind of phobia about them. But I've had so many animals that just fall asleep in the middle of their treatments. So I highly recommend talking to your veterinarian about that.
I have to admit that I was very skeptical. Mm-hmm. And we do have a local veterinarian close to me that does this. And one day she was there. I said, how can it not hurt having a needle push through your skin? She says, do you want to try it? I said, sure. So I tried it, and she was right. It really, for some amazing reason, did not hurt as it went through the skin. I was shocked.
It's incredible. So I think, working with veterinarians that are open-minded in these areas from a pet parent perspective is so important because, we're people too when we learn things every day. And acupuncture definitely opened up my eyes.
What are some of the other things?
Well, there's a whole realm of physical therapy for pets that really didn't exist, 10, 15 years ago. And they use a lot of the same machines that we do in the human side. So things like therapeutic lasers, neuromuscular electrical stimulators, transcutaneous electrical nerve stimulators, or TENS. You hear of TENS units. People will get those for their back sometimes.
And I was using it last night myself. I love it.
Okay, exactly. And then shockwave therapy. So there's a ton of non-medical ways to help our animals. And, sometimes we do need to piggyback that on top of traditional medication, but just always know that your veterinarian has really an arsenal of different tools to use. And if they don't have these in their office, they're going to know somebody that does.
And sometimes just lowering the bed or having a ramp so your pet can easily get up and off of furniture or into or out of a car. Finding these pet heating pads that just put out a little trickle of heat. I have 2 cats, and I think I have 4 heating pads around the house, and they're just always on. I haven't burnt down the house. When you put your hand on it, it's like, this isn't even, oh yeah, it is on. And here in Southern California, it doesn't get as hot as where you are in New Jersey, but yeah, it still gets cooler. But this just kind of is just like, makes those joints feel good. So there's a lot of different ways to address pain.
Absolutely.
First thing, know that your pet's in pain. Dr. Loenser, where should people go again in order to get a good overview of how to know your pet's in pain, what to do, and who to see?
If they go to aaha.org, so aha.org, and in the little search engine, just type in pain management guidelines, or you can Google it, the AHA pain management guidelines. It will pop up, and it's a really in-depth read for anyone who's interested in pain management. And then also we have a toolkit that will be there as well, and that has a lot of information directly for owners. And if you are moving or you're looking for another veterinary hospital, do check out our hospital locator, also at aha.org, to find a hospital that's accredited by the American Animal Hospital Association, too.
And Dr. Loenser, if there's one thing that you want to leave people with, what would be that one statement?
You started off with it, where you said you know your pet. And if you think there's something off, do bring them to the veterinary hospital and talk through it with your veterinarian, because you may be dealing with a low-level chronic pain situation that really, they just can't communicate with you. And what a gift to be able to acknowledge that and give your animal as pain-free of a life as possible. So trust yourself.
Dr. Loenser, fabulous. Thank you so much for being with us today. I know it really helped a lot of people and a lot of pets. This is Dr. Bernadine Cruz. You've been listening to The Pet Doctor on Pet Life Radio. Please listen again next week. We'll have more information on how to make you the best possible pet owner. Take care. Have a great week.
Pets can be a wonderful addition to your life because they're a member of the family. Keeping them healthy and happy is important. Pet Life Radio presents The Pet Doctor with veterinary media consultant and veterinarian Dr. Bernadine Cruz. Whether you have a dog, cat, reptile, or rabbit, you'll find answers for your pets straight from the vets. The Pet Doctor, on demand every week, only on PetLifeRadio.com.